Hey everyone, welcome back to another great medical coding review. Today we are going over one of my favorites, the digestive system. If you are brand new here, you are watching part of a series that I am doing of medical coding reviews. We started with integumentary. We're going all the way through the different chapters of CPT. Today we are on digestive. So if you need more medical coding review, make sure you head back to the front page of the channel and you can binge watch the entire playlist. And I would also highly encourage you to subscribe and hit the notification bell so that you can get alerts when I post new episodes. My name is Victoria Moll. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. Now let's get into the coding review. So I talk about how in CPT, oftentimes when they order the codes, they go from like the top of the body to the bottom. So if you think of the digestive system, the first codes you're going to start seeing in this chapter are at the start of the digestive system. So at your lips and your mouth and then through the anus. And then actually at the very end is where we have our hernia codes as well. So we start with the lip section. We have excisions, repairs, and then other procedures, vestibule of the mouth, incision, excision, repair, other. Same thing with tongue and mouth, same thing with dentoalveolar structures. And then we have our palate and uvula follows that same method, incision, excision, repair, other procedures. Same with salivary glands and the pharynx, adenoids, and tonsils. After that, we get into our esophagus. So in the esophagus section, we have a little bit more than the others. We have our incision, excisions, but then we have endoscopies. So esophagoscopies, esophagogastroduodenoscopy, ERCPs, laparoscopies, repairs, manipulation, and then other procedures. Now in the stomach, we have our usual formula, incision, excision, but then this is where we also have things like our bariatric surgery. So your Roux-en-Y procedures, your gastric sleeve procedures, your lap band procedures. And you have to make sure that there are open procedures for those and laparoscopic. So you can see under that bariatric surgery, we also have another section that's just the laparoscopic versions. And in most cases, they are done laparoscopically. So then we have our intestines. Look, there's a huge length of intestines within your body. So it makes sense that there's a large section of different procedures for the intestines. So incision, excisions, laparoscopic incisions and enterostomies, and then excisions, repairs, and other procedures. So everything under that laparoscopy that's a little bit indented, those are all laparoscopic. Enterostomies, endoscopies of the small intestines, endoscopies of the stoma, introduction, repair, other procedures. Then we have Meckel's diverticulum and the mesentery, excision, suture, and other procedures. And now we're getting further down the digestive tract, right? So we're looking at things like appendix, incision, excision, laparoscopic. So if you're looking for a lap appy, we sometimes call them laparoscopic appendectomy. That's where you'll find that code under the appendix and then that laparoscopy section. Colon and rectum, we have incision, excision, destruction. Endoscopy, laparoscopy, excisions and repairs of the laparoscopy, repair, manipulation, other procedures, and then we're finally getting towards the end of the digestive system. So we have here anus, incision, excision, introduction, endoscopy, repair, destruction, other procedures, and then into our liver. So you'll find here some of the similar incision, excisions, but also things like liver transplants, repairs, and then laparoscopic procedures of the liver. And now I think this is the last slide that we have for sections here, biliary tract. So incision, excision, laparoscopic procedures. So if you're doing a cholecystectomy, that would be where this is because that's in the biliary tract. Pancreas, procedures there. Introduction, repair, pancreas transplantation. And then now we have some kind of miscellaneous stuff that is of the abdomen, peritoneum, and omentum. So incision, excision, laparoscopic things like laparoscopic introduction, revision, removal, laparoscopic initial placement, laparoscopic conversion, laparoscopic mechanical removal of obstructive material. And then we have other repair, and then that's where our hernia codes are. So if you're ever looking for a hernia code, they're at the very end of the digestive section there. And I have a whole other video if you're interested. I will link it up here in the card so that you can check out the video that I have specifically for hernia repair coding. And we actually are going to go a little bit over. We're going to touch on hernia repair coding as we go through. So laparoscopic, suture, and then other procedures. So there's a lot in this digestive section, but a good amount of it is fairly straightforward. It's not a super tough section. I used to do general surgery coding, and I liked it because it's actually one of the specialties that they start a lot of coders out on when they're kind of new, because some of the coding in general surgery is a little bit more straightforward than some of the very niche specialties. Now, as far as our ICD-10-CM coding, here's a lot of them are going to be chapter 11, right? Because that's our whole digestive system. So there's the plethora of those. But then don't forget, our cancer codes. If we have cancer of the stomach or cancer of the digestive organs, look at those C codes as well. You may need to use your neoplasm table for some of these. Another thing to even consider is, and I don't have it on the slide, but it's like our bariatric surgery patients, you're going to need to use sometimes those morbid obesity and BMI codes related to those. So this is the digestive system, and the primary structures of the gastrointestinal tract are the mouth, the pharynx, the esophagus, stomach, small intestine, large intestine, rectum, and anus. So some of the affiliated or accessory structures are the salivary glands, the teeth, the tongue, liver, gallbladder, and pancreas. One of the things I'd like to focus in on is the different endoscopy procedures. So a proctosigmoidoscopy is an endoscopic examination of the rectum and the sigmoid colon. Sigmoidoscopy is an endoscopic examination of the sigmoid colon and may include the descending colon. A diagnostic colonoscopy is an endoscopic examination of the colon from the rectum to the cecum, and then a colonoscopy is the endoscope is advanced to the proximal colon past the splenic flexure to the cecum or into a portion of the terminal ileum. Now, if you've watched my other videos, you know I harp on a lot knowing the layout of your book. So if you get a question about colonoscopies and you go to that section of your CPT book, there is a little grid that it will take you through that'll ask you all kinds of different questions. Did you go past this area? Did you go past this area? To help guide you to the right code when you're coding for things like colonoscopies and proctosigmoidoscopies. The other thing that's important to remember is sometimes you'll get asked a question, and I see this more, I think, on the COC exam, the outpatient coding. They ask more about those Medicare-specific G codes, and there are specific G codes for Medicare patients when they are performing sigmoidoscopies and colonoscopies. So be on the lookout for those HCPCS G codes that are for Medicare patients. So enteroscopy codes are reported with 44300 through 44346. And an enterostomy is an operation to make a passage into the patient's small intestines through the abdomen with an opening to allow for drainage or to insert a tube for feeding. And the opening is called a stoma. Just a side note in risk adjustment, those stomas often risk adjust because of the higher risk of infection when those patients have those openings, those stomas. Enterostomies may be either temporary or permanent and are classified according to the part of the intestine that is used to create the stoma. So if the ileum is used to make the stoma, it's called an ileostomy. If the jejunum is used, it's called a jejunostomy. And to choose the correct code, you're going to need to know that atomic site of where that stoma was created. So now hernia codes are another one. And again, I have that whole hernia video. I'll even link it in the description below of this video. So hernia codes are listed according to the type of hernia. But some of the other aspects you can come into is it strangulated or incarcerated, and whether the repair is an initial repair or a subsequent. There's also some age may be a factor as well. So for example, the code for repair of an initial inguinal hernia for a 4-year-old reducible is 49500. If the hernia was incarcerated, it would actually be a different code, 49501. So there's some procedures that are for patients over the age of 5 and then some for under the age of 5. So be careful of all of those different factors. As you're going through a hernia repair case, those are key terms you want to look for, underline, circle, highlight, so that you can get to the correct code. Those incarcerated, strangulated, the patient's age, initial, subsequent. Also, with a lot of the hernia repair codes, the mesh is included, so don't additionally code for the mesh for those ones where the mesh is included in that code. Now let's go over some case examples. So in this particular one, 20-year-old patient presented to the hospital for a sigmoidoscopy due to a history of bloody stools for 3 weeks duration. Patient was prepped and the sigmoid scope was passed without difficulty to about 40 centimeters. The entire mucosal lining was erythematous. There was no friability of the overlying mucosa and no bleeding noted. No pseudopolyps were identified. Biopsies were taken at about 30 centimeters. These were thought to be representative of the mucosa in general. The scope was retracted. No other abnormalities were seen. What CPT and ICD-10-CM codes are reported? So let's take a look at this in our books. So 20-year-old patient presented to the hospital for sigmoidoscopy. So we're going to start highlighting some stuff here. We have our A, B, C, and Ds. Our A, B, C, and D look like they're different codes. Like, look at this. So we have 45330, 45331, 45333, 45305. We could probably, in this case, just look at CPT and eliminate something from there. So let's take a look. So this is patient has a sigmoidoscopy. I'm just going to look at the CPT stuff for now. So sigmoidoscopy, patient was prepped, entire mucosal lining. There was no pseudopolyps. They took a biopsy. That's important. They took a biopsy. These were thought to be representative of the mucosa in general. There was a scope. Was retracted. There are no other abnormalities seen. Now, if I was looking at maybe some of the ICD-10-CM stuff, let's highlight that in a different color here. Let's go through some blue. History of bloody stools. That's probably, that's a dark highlight. History of bloody stools. Patient was prepped. Sigmoidoscope was passed. Entire mucosa, there's no friability, no bleeding, no pseudopolyps. These were thought to be representative of the mucosa in general. The scope was retracted. No other abnormalities were seen. So I'm thinking this ICD-10-CM code is probably bloody stools. And then I'm looking for a CPT code that's a sigmoidoscopy with a biopsy. For this one, I'm going to go through my table of contents here. So colon and rectum. And this is an endoscopy. So we're going to be over here on page 368. You could also look this up in the index under sigmoidoscopy and then biopsy. So let's take a look here. 4, 5. So this is a proctosigmoidoscopy. That's not what we did. We just did a sigmoidoscopy, which is over here. So we have sigmoidoscopy, flexible diagnostic, including collection of specimens, brushing or washing when performed. We also have, with biopsy, single or multiple. Yes, I think this is it. 43331. Is that one of our options? B. Yeah, that's our option B, 45331. So the other options are the 330, which this doesn't indicate the biopsies. 333, with removal of tumors, polyps, or other lesions by hot biopsy forceps. I didn't see anything in here about forceps. And then the other option is 45305. Yeah, 45305 was under that proctoid sigmoidoscopy, so that's definitely not it. So I'm looking at option B. And let's just take a look. What is that K92.1? K92.1 is the blood in the stool, so that's what it was from. Yeah, so we highlighted that blue section correctly. Awesome, awesome. So this one is 45331, which is our sigmoidoscopy with biopsy, and then K92.1 for the blood in the stool. Next, we have 68-year-old patient is admitted to the hospital with a diagnosis of stomach cancer. Surgeon performs a total gastrectomy with formation of an intestinal pouch. Upon inspection, there is noted spread of the disease, and the physician also performs a total en-bloc splenectomy. What CPT codes should be utilized? So here I'm going to look at that this is a total, I'm going to highlight this, total gastrectomy. Not a partial, but a total gastrectomy with formation of a pouch, an intestinal pouch. That's important. And then they also did a total en-bloc splenectomy. Total en-bloc. So total gastrectomy, total en-bloc splenectomy. What CPT codes should be used? And then here we have 43622, 43622 with 38100, 38102, and then we have 43622 43634 with 38115, and then we have 43634 with 38102. And some of them have 51 modifiers, some of them do not. So we might have to look at, like, is the modifier 51 exempt, or can we use modifier 51 on them? So these codes all sound like they're right in the same range of each other. 43622. Let's take a look at what that is. 43622. So 43622 is gastrectomy total, and then with formation of intestinal pouch any type. So that does sound like what we did, 43622. Now that's our answer. A and B, they're both 43622. So we might have to decide what's that additional code that we're going to bill then for that portion that's the splenectomy. Let's take a look though at 43634, which is in our option B. 43634 is a gastrectomy partial distal with formation of an intestinal pouch, but we noted here that this is a total gastrectomy, so it's not this code. It's going to be up here with our total. And then we have the formation of the intestinal pouch anytime, so it's definitely our 43622. So let's get rid of C and D. I don't want to even look at them right now. So it's definitely not C, and it's definitely not D. This might even come down to like a modifier 51 thing. Let's take a look. So let's look at this 38100 codes. So 38100 is a splenectomy total. And then I'm looking at 102. 102 is an add-on code. Add-on codes also do not get modifier 51s on them. So I'm already thinking A's out because we don't use add-on codes on here. So total end block for extensive disease. Yes. Oh, that's what we did. So we highlighted there that end block, total end block. So this full description is, we'll go back, splenectomy, and then there's our semicolon. So that's where we stop, splenectomy. Pick back up over here on our add-on, total end block for extensive disease in conjunction with other procedure, list in addition to code for primary procedure. Does it give us any instructions here saying only to use it for certain codes? Nope. So we should be good. I'm thinking it's answer B, no modifier 51, because we don't use a modifier 51 on add-on codes, and that's what we got. So we have 43622 for the total gastrectomy with the formation of the intestinal pouch, and then 38102 is our end block splenectomy. That's an add-on code. Okay, two more cases. 3-month-old pediatric patient has a complete unilateral cleft lip repair. What CPT code should be utilized? So interestingly, one of the first articles that I published for Healthcare Business Monthly, actually I think it was the second article that I published, was on cleft lip and palate repair, and that's been a while since I did that. So if we go to our table of contents, we have here lips, excision, and repair. So that's where we're looking at, that page 335. Some of the key terms here: unilateral, it's the cleft lip, and we're repairing it. Complete unilateral cleft lip repair. So let's take a look here at our repairs. So here's the different codes. We have our plastic repair of cleft lip or nasal deformity, primary, partial, or complete. So partial or complete. This one is complete. Unilateral. This one is primary bilateral. Nope. Primary bilateral. Nope. Secondary. Nope. What's the other code? 40650? 40650 is repair of lip full thickness. So this is a cleft lip. This is specifically a cleft lip. And then we have 42200. I think that's one of the cleft lip and palate codes. Yeah, 422 is palatoplasty for cleft palate. This is a cleft lip. So we're going to look at, for this one, our 40700 code, and that's the right one. So 40700, plastic repair of cleft lip nasal deformity, primary, partial or complete, and this one was complete, unilateral. Okay, last one. 56-year-old patient has a partial bowel resection with colostomy for primary colon cancer. What CPT and ICD-10-CM codes should be utilized? Now, the interesting thing, if you look at this particular sample, is all of these diagnosis codes are the same. So they're not really going to trick us anywhere with the diagnosis codes, because those are all the same. So C18.9, 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 C18.9. So we're really more so looking at the CPT code here and how we differentiate that. So 56-year-old patient has a partial bowel resection colostomy for primary colon cancer. So what should we highlight here? Let's take a look. Let's get our highlighter out. So I'm thinking partial bowel resection with colostomy, and that's what I'm going to look for. So let's start with the partial bowel resection. So let's go over to our intestine section, and this is a partial bowel resection. So we have 44160, 140, 45385, and 44140. Those are our options. So 44140, colectomy partial with anastomosis. You know, I like that. Colectomy partial. This was a partial, right? Partial bowel resection with colostomy. With skin level cecostomy or colostomy. Did we do a colostomy? That's what we did here, right? With colostomy. So I'm thinking 44141. Let's check our other codes. 44160. What is that? 160. 44160 is colostomy partial with removal of terminal ileum. We did not do that. 45385. 45385 is, let's go back, hold on. Going back to our colonoscopy flexible diagnostic, including collection of specimen. Colonoscopy flexible with remover of tumor polyps or other lesions. That's not what we did. So this definitely was our option D that we looked at, our 44141 code. So what do you guys think of the digestive system? It is actually not too bad, right? What is your favorite one so far? Definitely let me know in the comments below. I will see you guys in the next video, and until then, you just keep on coding on.